Good morning, all of you. I am Dr. Monica B., working as an assistant professor in the Department of ECE at SR University, Warangal. Today, I am going to explain about measurement techniques in medicine. So, the contents are introduction, objectives, classification of measurement techniques, basic measurement system, in medicine, important measurement characteristics, errors, reliability, validity, calibration of medical instruments, safety considerations in the measurement setup, and elements of a medical device. So these are the contents of the day. Next, introduction. Introduction to medical measurement techniques. Here, the measurement techniques in medicine are at the heart of modern healthcare. These will provide the quantitative assessment of physiological variables. These techniques are indispensable for precise diagnosis, continuous patient monitoring, and guiding effective therapeutic interventions. So, with the help of measurement techniques, we can go for the effective therapeutic inventions, and these are considered as the fundamental backbone. So the medical devices are called as a fundamental backbone of the biomedical instrumentation. These will enable the transformation of complex biological events into discernible and measurable electrical signals. Next, the objectives of medical measurement. The primary objective during the development and application of any medical technique is multifaceted, means it is aimed for enhancing and aiming the enhancement of every aspect of the patient care. So accurate signal detection to precisely detect and capture a wide range of physiological signals, often subtle and complex, from the human body without introducing artifacts or any distortion. So, accurate signal detection to detect any signal precisely for a wide range of physiological signals, we often go for the human body without introducing any of artifacts or distortions. Next one is the continuous monitoring. Sometimes a disease should be monitored for a long period. For example, 1 week. After observation of 1 week or 15 days, then itself the health condition can be properly assessed and the diagnosis can be done. After seeing the 1 week or 15 days, after recording the patient's data, then we can see the periodic observation. This is called as the continuous monitoring. So to enable the uninterrupted, so uninterrupted 24 hours within 1 week or 15 days, the patient will be within the observation of the hospital and his health condition will be observed, and this will allow the early detection of changes, trends, or critical events in the patient physiology. Next one, diagnosis and prognostic support. To provide objective data, the clinics aid making informed diagnosis and predicting the diseases. So this is diagnostic and prognostic support. Next one is the treatment evaluation. So how to evaluate the condition of the patient, and what, based on the condition of the patient, the doctor will determine or decide the treatment process, what treatment can be given to the patient. Sometimes the patient can be cured with the help of the medicine. Sometimes there must the patient must undergo some surgical process like minor or major operations or surgeries. Sometimes even though the condition is worst, the patient cannot undergo the operations or surgeries because of his age or other factors. So how to decide this one? For that we need the help of treatment evaluation to assess the effectiveness of the therapeutic and allow the adjustments and optimizations in the treatment plan. So based on the condition of the patient, the treatment plan will be adjusted and optimized according to his condition. If the patient is elderly patient, then at this age, instead of taking his life into risk by undergoing some critical operations, whatever may be his lifetime, we can extend his lifetime based on the medicine support only. So if the patient is at the younger stage and he can able to withstand or he can able to face the surgery, then at that age surgeries can be planned for the patient. So like this, the treatment evaluation can be done based on the adjustments and optimizations depending on the we can plan the treatments. Next one is the patient safety and the comfort. This is a very important topic. So patient safety. At end of the day, everyone is concerned about the safety. Whenever we are going for the hospital, we will ensure that the procedures are safe and everything is safe as extent possible. And some people will take the comfort also into consideration. So, a medical measurement can take the safety and comfort of the patient into consideration. So, these are the objectives, important objectives. First one, accurate detection. With whenever you are accurately detecting the condition of the patient, then only proper treatment can be given. Then continuous monitoring. Sometimes patient should be monitored for a longer duration to come to a conclusion. Then the diagnosis based on the data, we can diagnose his condition, and after the treatment evaluation of based on the condition of the patient, we can optimize the treatment plan which is suitable for the patient at that age. And finally, safety of the patient and comfort of the patient. Next one, classification of the measurement techniques. Here the measurement techniques are classified. First one based on the invasiveness. So measurement techniques can be broadly categorized based on the degree of invasiveness. It is also a crucial factor influencing the patient comfort, risk, and types of physiological data that can be acquired. Both invasive and non-invasive methods play vital role and complementary roles in the clinical practice. So invasive measurements and non-invasive tells about the degree of the invasiveness, means to what extent it is coming in physical contact with the body of the patient. Invasive measurement. Invasive measurement techniques involve instruments that physically penetrate the body or make direct contact with the internal tissues. These methods often require surgical procedures or punctures. If you see in this diagram, we can observe here that the needle is going inside the body of the patient. This is the body surface of the patient, and where here the needle is inserted inside. Means the body is making direct contact uh, with the needle. Here invasive, this is called as invasive. Advantage. Direct and highly accurate measurements. Invasive will give the highly accuracy, and continuous monitoring can be possible with the help of the invasive and internal physiological variables. And disadvantages: the risk of infection is more in the invasive. Patient discomfort and he will feel pain for some time. And the examples are blood pressure catheter. It is a direct arterial line measurement. It provides the continuous and precise blood pressures readings. Sometimes we need to take the continuous BP of the patient. Intracardiac ECG. So electrodes placed inside the heart allow detailed cardiac electrophysiological studies. So biopsy is also called as a invasive method. Biopsy means the needles for tissue sampling and pathological analysis. So it will be sent inside the body of the patient. This is about the invasive measurement. Next one, non-invasive measurement. Here if you observe, see, non-invasive, it is not in contact with the body of the patient. Here the measurement techniques do not require the penetration into the body tissues. This will make safe and comfortable for the patient. Here in this case, patient will not feel any kind of pain or discomfort. He will completely feel the safety. These methods rely on external sensors to detect the physiological signals. So non-invasive means does not require penetration. Invasive means it is direct contact with the human body. So what are the advantages of non-invasive measurement? First one is the safe and painless. The patient is feel very safe. It has very lower risk of infection and suitable for repeated or long-term measurements. Disadvantages: indirect measurements, potentially lower accuracy and compared to the invasive methods. Susceptible to the external noise and interface. These are interference. These are the disadvantages. Examples: the ECG, electrocardiogram. It is externally placed electrodes on the body of the patient. For example, electrodes are placed on the chest of the patient and the electrical activity of the heart is recorded. EEG, electroencephalogram. Scalp, we will place the electrodes on the scalp of the patient and then the it is observed the electrical activity of the brain and neurons is observed in the EEG signal. This is also a non-invasive method. Next one is the pulse oximeter, a sensor placed on the fingertip. It will collect the information about the oxygenated and deoxygenated blood. Next one, infrared thermometer. So body temperature can be measured with the help of the infrared thermometer. These are the classification based on the invasiveness. Next one, based on the signal type. So what signal we are going to measure, then based on that also you can see this is based on the signal type. So beyond invasiveness, medical measurement techniques are also classified based on the fundamental type of physiological signal that they are going to detect. So this helps in the understanding of diverse physical and chemical phenomena that are quantified to assess the health issues. So first one is the bioelectrical measurements. So bioelectrical measurements means this will measure the electrical signals generated by the human body. First one is the ECG, electrocardiogram. Next one is the electroencephalogram, EEG. It measures the electrical activity of the brain. Electrocardiogram measures the electrical activity of the heart. EMG, electromyogram. This detects the electric potentials of the muscles. Next, EEOG, electrooculography, it records the eye movements of the patient. Next, biomechanical measurements. So, focus on the mechanical aspects of the body such as forces and pressures and movement. These vital assessing cardiovascular respiratory mechanics. For example, BP, blood pressure, measures the indirectly using the cuff of the patient, and respiratory directed through the chest, and plethysmography measures the changes in the organs. So these are the three biomechanical measurements. Next, third category is biochemical measurements. So it involves the chemical substances in the body, fluids or tissues. First one is the blood glucose, essential for diabetes management. Blood gases pH, PO2 and PCO2, it critical for respiratory problems. And metabolic status. Electrolytes indicates the fluid balance in the kidney function. Na plus and K plus electrolytes. Enzyme levels marks the organ damage or diseases. These are the biochemical measurements. Biothermal measurements. It is concerned with the body temperature and regulation. So it provides an insight into the metabolic rates, infections, etc. Body temperature can be seen by oral or rectal skin temperature measurement, and thermography, imaging techniques that display the distribution present in the body surface. So this is the temperature measurement. Next one is the biooptical measurement. So pulse oximeter measures the blood glucose, and it utilizes the light interaction with the biological tissues, and imaging sensing, optical imaging and fiber optics. Techniques like near infrared spectrography to study the tissues, and fiber optics, it uses the endoscopes for internal visualization. So these are the 5 techniques of classification of medical instruments or techniques based on the signal type. Next one, basic medical measurement system architecture. So if you see the total block diagram or the architecture broadly can be considered as 5 blocks. First one is the measurand. Okay, measurand is nothing but the variable which we are going to measure, or the physical quantity. For example, BP, we are measuring BP of a patient, then BP blood pressure is called the measurand. Second one, sensor and transducer. So what type of sensor and transducer you are using for measuring this one? For example, if we are measuring the body temperature, then we take the help of the thermistor, that is the sensor or the transducer. Next, third step is the signal conditioning. So after this stage, the raw electrical signal can from the sensor make it suitable for the further processing like amplification, filtering, isolation and impedance matching. Next one is a data processing unit. Here we can do the analog data processing and digital data processing. And third, finally, display and recording unit. Here we will display the values obtained, and we can also record the value of the physiological quantity we are measuring, and we can save it for the future use like recording. Next one, important characteristics, static characteristics and dynamic characteristics of the medical measurement. Static characteristics, first one, accuracy. It is the closeness of the measurement value to the true value. So it reflects the correctness of the measurement. Precision, the reproducibility or consistency of the measurement under identical conditions. Sensitivity, ratio of change of the output to the change in the input is called the sensitivity. Resolution, the smallest change in the measurand that an instrument can detect is called the resolution. Linearity, the degree to which input is output relationship is linear is the measure of linearity. And drift, the change in the instrument output for the time constant input. These are the static characteristics. Next one is the dynamic characteristics. The speed of the response, how quickly the measure instrument responding to the sudden changes. Fidelity, the degree to which the instrument accurately reproduces the changes in the input signal without dynamic error. Bandwidth, the range of frequencies the instrument can work properly is called its bandwidth. And dynamic error, the difference between the time varying measurement indicated by the measurement is called the distortion is present, we can say. So these are the static and dynamic characteristics of a measurement system. Next one, errors. There are totally three types of errors in the medical measurement. First one is the systematic error. This is due to the inherent measurement system or the method. For example, incorrect calibration and sometimes consistent sensor offset can be present, and environmental effects such as temperature deviation, etc. All these will give rise to the systematic errors. Second one is the random errors. These are the unpredictable variations that occur due to chance. We are unable to predict this unpredictable random errors. For example, electrical noise. Third one is the gross errors, blunders we can call it as, such as human mistakes or the instrument malfunction. These errors are usually indefinable and preventable with careful procedures. So, reading the incorrect value, or by noting down the incorrect value, or misreading the scale, or direct entering the data with the mistakes, taking component failure, component, etc. All these come under the gross error. So these are the three kinds of errors present in the medical measurement. Now, safety. The electrical isolation must be maintained. Medical devices must incorporate the robust electrical isolation and to protect the patient from the stray effects or stray currents, you can call leakage currents. So strict limits must be imposed on the allowable limits of the leakage current so that patient will be safe and there will not be any risk. And patient grounding, proper patient grounding is also mitigate the electrical hazards. And compliance with standard, medical device must comply with the international standards, then only we can the patient can be ensuring efficiency and safety. Next one is the elements of the medical device. What are the elements present in the device? So medical devices or instruments are also called as apparatus, or also called as tools used for the diagnosis, prevention, monitoring, treatment, or elevation of devices. Regulatory framework. So it should strictly follow the regulatory scrutiny of ISO or FDA or CE marking. Impact on the healthcare. The development of advanced medical devices has revolutionized the patient health. Types of medical devices. So there are totally three types of medical devices broadly classified as. First one, diagnostic devices. These are used to identify the patient condition. For example, X-rays, MRIs, and as well as lab instruments, blood test will come under the diagnostic devices. Next one is the therapeutic devices. Devices such as pacemakers influence the infusion pumps, etc. are called therapeutic devices. These will do some therapy to the patient. Surgical instruments, tools used in the during the surgery procedures comes under the surgical instruments. So three broad categories of the medical devices are diagnostic and therapeutic and surgery instruments. Next one, key components of medical devices. So what are the key components means? First one is the sensor and transducer. It will convert the physiological parameter into the electrical signal for the purpose of monitoring the health parameters. Second one is the microcontroller and the processor. The brain responsible for processing sensor inputs and executing the commands. Power supply systems. external sources ranging from batteries to plug in the supplies for uninterrupted operation. These are the three key components of the medical device: sensors and transducers, microprocessors and microcontrollers, power supply. Next one, functions of the medical device. What are the different functions performed by a medical device? Our first one, monitoring function. A medical device will allow or track the vital signals of the patient, allowing the healthcare professionals to take a decision based on the continuous data generated by the medical device. Therapeutic functions. A device can deliver some amount of medication or infusion or electrical stimulation to the assist the patient who is suffering from a particular disease so that it will help him to recover and management of the present condition also. So therapeutic function can also be performed by the medical device. Third one is the data management. Modern medical devices often incorporate data management systems that store the and analyze patient data, aiding the healthcare provides the tracking and outcomes of the patient. So these are the three functions mainly performed by the medical device: monitoring, therapeutic, and data management. And what are the applications of the medical device? So medical devices mainly, if we observe, we will see in the hospitals and the clinic. That is the first important application of any medical device. It is used for diagnosis, patient monitoring, and the treatment of the patient. If you see, three important function: monitoring and treatment and diagnosis. Diagnosis will help the doctor to come to an idea or about the condition of the patient. Monitoring means for 1 week or 10 days, if we observe the patient, then we can optimize his treatment plan. Third one is the treatment. So these are the used in the hospitals and clinics. Nowadays, our health also, our home also, we are carrying some health care, and we are maintaining some small medical devices. For example, to check the condition of the patient at, to check the condition of the patient at the home, we can take the help of the medical devices. Next one is the telemedicine, facilitating the remote healthcare and monitoring the process. These are the three important applications. First one is in the so these are the applications of the medical device. Next one, innovations. What are the innovations we are seeing in the present scenario? That is, first one is the wearable technology. Advances in the wearable devices enable the continuous health monitoring, provide the real-time data to both the patients and the healthcare providers, and this will help to manage the health conditions. Second one is the smart implants. Modern implants are being designed with embedded sensors which are sending into the communicate with the external devices, and they are improving the patient outcomes and monitoring and also feedback also. So third one is the 3D printing. This technology is transforming the design of and production of medical devices and allowing for customized solutions and tailored to the individual patient needs, enhancing both the comfort and the effectiveness of the patient condition. So innovations in the medical devices, already we are seeing in our day-to-day life that we are getting them: wearable technology, smart implants, and 3D printing. Next, future trends. What are the future trends we can see in the field of the medical devices? Means AI integration, intelligence integration. AI is expected to enhance the decision making process, diagnostic treatment, and it will personalize the recommendations based on the patient data analysis. Next one is the IoT, Internet of Medical Things, IoMT. So the connectivity between the devices improve the data sharing, monitoring and patient care coordination, enhancing the overall health care. Third one is the regenerative medicine, the development of devices that promote the tissue regeneration. It will hold the promise for the treatment of injuries, and the condition of the patient can be quickly improved. So with the help of the regenerative medicine, these are the future trends we can expect in the field of the medical devices. Artificial intelligence integration, with the help of AI, we can make the decisions. Based on that, we can further improve the condition of the patient, and providing the personalized recommendations, what is suitable for the patient and what is not suitable. And IoT, Internet of Medical Things, the connectivity between the device and the improve the data. After that, regenerative medicine. So these are the future trends in the medical devices. Thank you.